The numbers of COVID-19 infections in the EU continue to decline. As the latest risk assessment from the European Centre of Disease Prevention and Control have shown us, as of the 9th of June, the 14th-day incidence in the EU overall has declined by 80% since the peak, which was on the 9th of April. It is clear, however, that this pandemic is not over and we are not yet out of the woods. Continued vigilance is a must, and we must be ready to roll back the relaxation of measures if needed. One of the lessons we have learned is that Europe needs to give a higher priority to health, including through increased investments in healthcare. And that is precisely why we are looking into the future. We will open a new chapter in EU health policy and funding with our EU for Health programme. With a 2,000% increase in financial resources, it represents an opportunity to do something bigger, to make sure that what started as a health crisis becomes an opportunity for the health sector to lead in the recovery. For the first time, we will create strategic stockpiles of protective equipment, of medicines and medical devices in times of crisis. We will have a reserve of healthcare staff, including flying doctors, that can be deployed wherever and whenever needed. EU for Health is also about ensuring that medicines and medical devices are available when needed at all times. And finally, it is about building up the resilience of health systems of tomorrow and making a real difference for important priorities such as the fight against cancer, the reduction of the number of antimicrobial resistant cases, and improving vaccination.